Please welcome into the Community Access Studios, Dr. Albert Lowe, who is the Director of Neuroscience Research at the Joyce D and Andrew J. Mandell Center here in Hartford. Welcome, Doctor.
Well, thank you so much. Such a pleasure to be here.
Well, I'm so happy you're here because I love when I can get an actual doctor in the room and I can ask you certain questions that only a doctor can answer, like, Dr. Lowe, why don't we have a cure for MS yet?
Well, I think that's a fantastic question. I think part of it is we don't fully understand what causes MS. Some people have in the past have thought it to be viruses. Now we know there's a number of genetic factors, a number of environmental factors, but generally there's no one cause. There's no one test for MS. So unless you absolutely know, it's very difficult to cure MS.
It must be very frustrating as a doctor to try to rein in what MS is and does to people.
Well, you're correct. I think it's frustrating for doctors and obviously people with MS.
Right.
I mean, it has all kinds of effects on your nervous system, your motor function, the way you think, the way you feel. Some people have pain. So I think that thinking about it as an umbrella term is actually a good way to think about it because everybody's a little bit different. But there are some common issues. It mostly affects people when they're young, in their 20s. It is an autoimmune disease of the nervous system. It is chronic and is progressive. So some people group MS into one big term, multiple sclerosis. There are some people think it's a bunch of different kinds of disease that all follow under the umbrella. But nevertheless, I think when it comes to the patient, it really affects each person differently. And as a physician, it means we have to kind of tailor the therapy more individually to people.
All right, so Dr. Lowe, you're focused on neuroscience research and rehabilitation. What research are you working on now, and do we have any kind of light at the end of the tunnel? Are we seeing any improvements here?
Well, I think it's an incredibly exciting time for all research and therapeutics in MS. I mean, as some speakers, some of the people out there may know, there's a lot of new oral medications coming out for MS in the next several months. There's a new medication called dalfampridine that just was released earlier this year for symptomatic treatment of MS. So a lot of the research we do that I'm involved with is rehabilitation research or exercise research. And I think more than ever, this aspect has become more important to people because what we're focused on is not just drugs, just giving a person a drug, but how can they function better? So some of the research we do is with robots, and some of the robots help people to walk a little bit better. And what we're focused on is for people that have problems with balance or falls or walking, can we help them function better in everyday life? These robots that we use are either designed or made in Switzerland or in Cambridge by MIT. And what they do is you wear them. All the robots we use are kind of wearable robots, but they're meant in the clinic. They're pretty big. So the leg robots we use are called the Locomat. And they weigh about a ton, and they have a big treadmill, and there's a big harness system that suspends you over the treadmill. Then there's two exoskeletons that come on the side of your legs. There's little carbon fiber cuffs that hold you on the thigh and the ankle. And what it does is it helps facilitate thousands and thousands and thousands of steps that maybe the person could not do just on their own or even with the help of therapists. So
wow, and does this really help with the rehabilitation? Have you seen some improvements off this?
So that's what we really focus on is really the research because a lot of places will just put a person in and not necessarily test whether or not it's effective. And what we're trying to do is, does this machine that is nearly $300,000, what does it really do? What does it really do to help the person? Can it do more than what a therapist does? Can it do more than any number of other pieces of equipment? So I think the bottom line answer is it can. It works better for some people than others. So if you can't walk, it certainly can help you more. For people that walk fairly well, it helps you to do the therapy. But I think what robots do best is repetition and labor-intensive work. So it's sort of like you can mow your lawn with a manual clipper, or you can mow your lawn with a power mower. I mean, does the power mower do it better? Probably not, but you save a lot of labor doing it. So, and that's sort of a pretty simple analogy, but it's also getting a person to do 2,000 steps. Can two people helping you do those steps do it? Probably, but it's a lot of work for them to do it. And if the robots can sort of unburden those people to do it, the therapist is really concentrating on coaching you, interacting with you, motivating you to do that.
Well, MS is just, I've learned so much over the past few years from working with the Connecticut chapter and what this disease does. And I still feel, even after maybe I think it's 3 years now, I still feel like I keep learning some of the devastating effects of this disease, because, we started off with this interview saying, like, everybody has it a little bit different. And what amazes me is that someone could be blind for a week, and then all of a sudden they see. Somebody could wake up and be paralyzed. One of the spokespersons that we dealt with a couple years ago, I think it was David Osmond, woke up one day and he was paralyzed from the waist down. Now all of a sudden he's back up again. I mean,
well, I think we're going into a new era about trying to treat MS, and I think what's very frustrating for patients is most of the medications is to slow down disability. So nothing prevents it from completely stops the disability, just to slow down disability. And MS affects young people. And what young people want is to not say, I'm only going to get maybe 10% worse next year rather than 20%. They really want to get better. Yeah. So what we're trying to do is be much more proactive about getting higher levels of function, maybe walking better next year than you did this year, be able to use your arm better next year than this year, that sort of thing, to be a lot more, I guess, positive about treating the disease.
Well, ctfightsms.org is the website for the Connecticut chapter for the MS Society. Please check them out and get information about events, fundraisers, volunteering. There's also information on if you're a caregiver or if you are newly diagnosed with MS. It's just a great informational website, ctfightsms.org. And I would love to be able to come down and just take a tour of your facility if you wouldn't mind.
Yeah, you need to. And thank you so much, Renee, about talking about this very important disease.
Absolutely. Dr. Albert Lowe, Director of Neuroscience Research at the Joyce D. and Andrew J. Mandell Center. All of the information about the Mandell Center will be at mycommunityaccess.com. Thank you, Dr. Lowe.
Okay, thank you.
This is my community.
This is my community.
This is my community.